The anticatabolics. Glutamine. Glutamine is an abundant, non-essential amino acid. So the 20 amino acids that we have in our diet, this is one of those. The source, we can produce it from in the skeletal muscle and in the liver, but we also find it in plant and animal sources, so it's readily available. The claim here is that it's going to promote tissue repair, reduce muscle catabolism, so prevent muscle degradation, and prevent infections and boost immune function. Efficacy and evidence for this, there's actually many human trials showing some tremendous benefit, especially in a clinical setting. Glutamine is used quite a bit to enhance gastrointestinal tract function. Side effects, it's well tolerated up to about 20 to 40 grams per day. The application of this, about 1 to 10 grams per day for immune system and anti-catabolic function. Alpha-Keita glutarate, it's an intermediate of the Krebs cycle or the citric acid cycle or the TCA cycle. They're all pointing to the same cycle. It's a precursor for glutamine, glutamate, proline, and arginine. It's endogenously produced. The claim here is that it's an anti-catabolic agent for skeletal muscle, so you're going to preserve that muscle mass. As far as efficacy and evidence, there's actually some evidence for reduced muscle mass loss after surgery in patients. So in athletes, it doesn't seem to have the same effect. But, of course, more research is warranted. As far as side effects, none has been reported. Application of this, about 0.28 grams per kilogram of body mass per day. Ornithine ketoglutarate, or AKG, that's ornithine plus alpha-Keita glutarate. So again, claim here, anti-catabolic agent. Efficacy and evidence, it's been used successfully to treat burns, used post-surgically in malnourished individuals and wound healing patients. It's administered both enterally, so via the gastrointestinal tract, via tube feed, and parenterally, used or administered outside of the gastrointestinal tract. As far as side effects, there are none reported. Application of this is up to about 30 grams per day. Branched chain amino acids, or BCAAs. These are three branched chain or essential amino acids that we find: leucine, isoleucine, and valine. The food source here, basically a variety of food sources that contain protein. The claim here is that we can enhance endurance performance and enhance post-exercise recovery. The efficacy and evidence, there are mixed findings. There's some evidence to suggest that there's an improvement in mental performance, improved cycling endurance, and reduced marathon completion time. There are some comparisons with carbohydrates that yielded some similar results, so we're not quite sure whether it's branched chain amino acids or carbohydrates. We definitely need more research in this area. As far as side effects are concerned, anywhere from 3 to 25 grams per day. There were no adverse effects reported. Higher doses, you have to be careful and watch out for this. You may get competitive inhibition of other essential amino acids. That is, if you have too many of the branched chain amino acids present in the gastrointestinal tract, they will compete for the transporters of some amino acids, including the branched chain amino acids, that are all sharing the same transport system, and you will actually absorb the amino acids that you have the most of. So if you're ingesting a huge amount of branched chain amino acids, those are the amino acids that are going to get preferentially absorbed simply because there's more of them around. So there's potential there for becoming deficient in other essential amino acids. The practical application of this, anywhere from 3 to 20 grams per day before or during exercise or post-exercise as a recovery aid. Leucine, a branched chain amino acid. Again, we just talked about the branched chain amino acid. These are synthesized from keto acids endogenously. We have a variety of leucine food sources, and anytime you're consuming proteins, you may be consuming leucine. The claim here is that we're going to enhance protein synthesis and degrade protein or decrease protein degradation. Efficacy and evidence for this is it's mixed. For protein synthesis, it doesn't seem to affect protein synthesis. However, protein degradation actually may prevent protein degradation when you consume just leucine. Side effects, it's well tolerated. The application of this is about 0.2 grams per kilogram body mass per day. Alpha-keto isocaproate, or KIC, it's produced from the transamination of leucine. So transamination is just transferring the nitrogen group from one amino acid to another. So you're transferring the nitrogen group from the leucine amino acid to ketoisocaproate. The source, it's endogenously produced. The claim here is that it's going to spare nitrogen during times of fasting. So when you don't have a meal present that's being processed, you may actually be able to preserve some of that nitrogen, which is important in maintaining protein, like muscle mass. Efficacy and evidence, there's mixed results on this. It may reduce nitrogen loss in some studies. However, it's going to induce ketosis. So remember, when we're inducing ketosis, you produce more ketones that could potentially lead to decreases in blood pH. There weren't any other effects in other studies. So it's kind of mixed, and we need to have more research in this area. Side effects, there don't seem to be any reported side effects of this, and the practical application basically follow the recommendations made by the manufacturer. Whey protein. Whey protein is actually a milk product. It's the fluid portion of the milk obtained by coagulating or removing the curd or casein during cheese production. It contains a high level of essential amino acids. Like I said, the source is milk. The claim is that you're going to increase muscle mass and, in some instances, use it as an ergogenic aid. Efficacy and evidence of this, we really need more research in humans in order to substantiate these claims. Side effects, there's a potential allergic reaction. So if someone is allergic to milk proteins, then this probably isn't the substance to be consuming. High doses may actually cause diarrhea. The practical application of this is about 20 grams per day in 2 doses. Casein protein. So casein is the curd part that is used in the cheese making process. So milk and cheese are going to be your sources. So the claim here is that you have enhanced protein synthesis and that you're going to reduce protein degradation. Efficacy and evidence. Just like whey protein, we have mixed data, so we need more research in this area to figure these things out. The side effects here, potential allergic reaction. Again, if somebody's allergic to milk proteins, then there's always the potential for having an allergic reaction. It may actually be a hypercholesterolemic agent because it does contain, or is manufactured from products that contain saturated fat. So that is a concern, because if it increases your cholesterol levels in blood, that may actually increase your risk for cardiovascular disease. Practical application of this is going to vary depending upon your athlete and the type of athlete they are. Milk protein isolates. These are extracted proteins from milk, and you can see that there are a huge number of proteins in milk. The claim here is that you're going to increase protein synthesis. Now, the efficacy and evidence, there's limited evidence, so we definitely need more research in this area. Some side effects, we can increase IGF-1, which may increase breast and prostate and GI tract risk for cancer. So that's a concern here. The application of this, again, is going to vary depending upon the athlete you're working with.